Welcome to Daryl's Little Corner. In the studio with me tonight is Bill Stone. Now, I know that most of us are familiar with him. If not, then this is the time to get familiar. Okay. Welcome to Daryl's Little Corner.
Well, thank you, and Happy New Year to you and all your audience. And it's just a great pleasure to be here today.
Great. Now, I want to start out. Now, you've been on here before, but it's been a long time.
A long time ago.
And I'm thinking we need to start with basics. Like, tell us where you're from.
Well, of course, I'm originally from Ashland. Now I live in Holly Springs.
I didn't know that.
I did. I moved to Holly Springs. You can remember back during the time I was representing Tippah County in the Mississippi Senate.
Yes.
My district was Benton, Marshall, and Tippah County, and I got caught up in a redistricting issue.
Yes.
And so what I did, they put Benton County in the district with Union and Pontotoc counties. And so what I did was I moved to Holly Springs and ran for re-election and was re-elected in Senate District 10, which was Marshall and Tate counties.
Well, that redistricting, that was a census, wasn't it?
It was. This was the one that was done in 2012. It was the 2012 redistricting.
Messed everything up. But now, are you a senator now, or are you retired from it?
I left the Senate in 2017, and for 4 years I was the manager at Holly Springs Utility Department, worked for the city of Holly Springs, and then again got caught up in another political, had an election that a new mayor was elected, and was making some changes, and I ended up out from the utility department, and subsequently ended up at North Mississippi Primary Health Care.
You know, that's the problem with these politic jobs. You don't ever know if you're going to have a job or not. 4 years and you're done.
That's right. And, the elections have consequences is what they say.
They do.
And, of course, I was recommended for that position by the former mayor, and the new mayor came in and wanted to make some changes, and ended up making those changes. So I ended up... It ended up working out for me. So
I've noticed that here in Tippah County we've had some of that where the new people that were elected are getting rid of the people that were there before. I don't know why, because they're experienced. They get rid of the ones that know what they're doing. How's that make sense? I don't know. I'm not political, you know that. What would I know? You're married?
I am. My wife is a former Debbie Samples from Ashland. We have 3 children and 5 grandchildren.
5 grandkids. How old are they?
The oldest one is 22.
22.
And the youngest one just turned 5.
You think 22 is grown, but it's not.
3 boys and 2 girls.
We thought we were grown at 22, didn't we?
We did.
Yes. Tell us who your parents were.
Of course, my mother is Hope Stone. My dad is the late Gordon Stone. He was, a lot of people in Tippah County remember him because he was the district district director for the old, what was ASCS at the time, Farm Service Agencies now, and ASCS, and he did that for 40 years or so, and had lots of friends all across northeast Mississippi from that.
Reason that I asked is I wanted to emphasize that you are deep-rooted in this area. You're not new to this area.
Oh, absolutely. Yeah. We,
I
grew up, I was mayor of Ashland for 6 years, and then I spent 10 years in the state senate, and so I know a few people around here.
Well, you have a care for people, and that's why this job is so good for you, because you have a care. I remember one time I met this girl. She was waiting tables at Huddle House. You remember her?
I do.
And she had a photographic memory, and I fussed at her. I said, "Honey, you're surely not going to be wasted waiting tables all your life." She said, "Oh, no, I went to nursing school." So every time I went in, I'd ask her how much you lack, and finally she said, "Well, I finished," and I sent in my application, and they tabled it on somebody's desk, and said that they could leave it there indefinitely. And I remember that I told her, I said, "Call Senator Bill Stone and tell him you have a problem." "Well, I can't call this late, and I can't do this, and I can't." What it was, she didn't think she'd get any help. But one night I went up there, and I had just talked to you, and I went up there, and I called her. She was working, and I told her, I said, "We're calling right now. Call him right now." And the next day, I think you called, made a phone call, and her papers miraculously were no longer tabled. But it impressed me that you have the heart to help people.
Well, that's what it's all about. I mean, that's what I enjoyed about being in the Senate, was being able to, the constituent services part of it. I think a lot of folks get caught up in the other aspects of it, but I'm going to tell you, I had. That's one thing I always tried to do, was make sure if somebody called me to call them back or take that phone call. Mm-hmm. And I run into people all the time, people that I don't even remember, and they said, you did this or that for me, and it's just I was not very good at the record keeping of it. I had some colleagues that kept a notebook and a list of everything they'd ever done, but I didn't do all that. But I just if somebody called on me, I tried to do what I could to help them.
Well, you changed her life. You did. You changed that young lady's life, and that spoke to me. It did. So you were state senator. Where do you go after you be a senator? What do you do next? I mean, you go out and just put in job applications, or what do you do?
Well, I left the Senate to take the job with the city of Holly Springs. So that was just, and I left in the middle of the term. I was reelected in 2015, and I served through the middle of 2017, and so I left the Senate to take that job with the city. Anticipating that I'd be there at least 8 years or 10, but it just didn't work out. But like I said, it all worked out in the long run.
Sometimes I think the Lord just opens doors for us. I just think that. Everybody their own thing, but I think that. But you are with North Mississippi Primary Health Care. Now, all of these doctor clinics have different names. This one is behind the Huddle House.
Right. It's Ripley Healthcare Associates is the one in Ripley. Walnut Medical Center is in Walnut. And then we have 7 other clinics from Oxford to Tishomingo. Of course, the home base and where it all started at is at Ashland. That's where the company offices, the corporate offices, so to speak, are. And that was the original clinic. Started in 1984, started as a community project, and it kind of grew from there. I mean, the first clinic, they took the old lumber company building and renovated it into a clinic, and with people from the community coming in, we've got pictures of those people in there working, and volunteer labor and that sort of thing to build this clinic at Ashland. It started out with a medical and dental clinic there, and over the years moved to Walnut, then on to Ripley, and then to places beyond. We've got clinics in New Albany, Booneville, Corinth, Tishomingo, a community clinic in Oxford, and also a school-based clinic in Oxford. So,
I didn't know you had one at New Albany.
We do. It's right there on Bankhead.
Really?
And it's New Albany Healthcare Associates.
How did I miss that? I'm telling you. When you called me, you told me you were a CEO. I had to ask somebody what that meant. I'm just out of touch. I don't know. Tell me. Okay, you worked your way up to CEO. Tell us what you do. I got the title down. I memorized it. I wrote it down.
Well, I'm responsible to the board of directors for the operation of the whole organization. We have about 126 or so employees. I think that was the last count that I had a few days ago, was 126. And in those different locations, about somewhere between 45 and 50 of those are at Ashland, because all the billing is there, all the admin is there, and that sort of thing. And then the others are spread out across northeast Mississippi. We are a federally qualified health center. We receive federal funding so that to make health care available, really we're serving the least of these. I mean, that's what it's all about. Is we see people and we treat people based on their need, not their ability to pay. So our vision and our mission is to provide health care regardless of ability to pay.
There's a lot of folks that are not working now. A lot of people are not able to work. During that time from when you put in for disability until you actually get a check started, that's a disaster.
It can be, yes, it can.
It really is. 2 or 3 years now.
And of course I understand that because of my time in the Senate. That's one of the things that I did a lot of work on, was people that would get those disability applications that would get hung up in the process, get delayed. One of the people, as a senator, one of the places that I called the most was the Department of Disability Determination, Disability Services, and that's to talk about to talk to them about cases that are out there.
If you owe money to a finance company and you miss that third payment, they repo it. So by the time that you get disability started, you done lost everything you got, everything you've ever worked for. Something needs to be done about that. It really does. Of course, that's on a federal level.
Well, part of it is, but the initial determination is done at the state level.
Really?
It's a state agency that does that.
I know that.
To the Department of Rehab.
Huh. That's good information. We need to remember that. Yes. But I just don't understand. I mean, you work all your life, and people live on credit now. It's not like it used to be. And like, say something happens, say you get hurt at work or you get hurt wherever or get a disease or something, it's all gone. You got nothing. That's just not right. No. And I hope whoever's supposed to take care of that is listening. Whoever. I don't really know. But we need to find out, because that really needs to be fixed.
It is. The process has gotten worse over the years. Of course, like I dealt with it, on at least a weekly basis for 10 years when I was in the Senate, and I still have people call me from time to time, and I still have contacts down at the Department of Disability Services, Disability Determination Services, I think is DDS is what it is. But and I still call them from time to time and ask them to check on things, and they're really good about talking to me, and even though I'm not in the Senate anymore. So
now I tell you, if you've got, say, a lady has a husband or a husband has a wife, to support them while they put in for it, you would survive. But some people maybe are single, didn't marry, by then their parents are deceased. They've got no help nowhere. And pretty soon they're out in the street. It's really bad, really bad. But something needs to be done about that. Okay, as CEO of this clinic, that is the most beautiful building. It really is. It's huge at Ripley. But you're concerned with all of them.
That's right.
Yeah. I've been to the one at Ashland. It's not hardly as large, I don't think. Or maybe it was full, I don't know. Well, it was a lot of people there when I was there. That's a lot of responsibility, isn't it?
It is, and when you think about our mission and what we do, You
Tell
think
us
about
about that.
the responsibility to the community. I mean, that's what we're there for. I mean, as a federally qualified community health center, that's what we're there for. We're there to serve the community, and that's the things that we've got to look at, and the things that we're accountable for with our federal funding is to take care of, is to make sure that we are working with other organizations in the community, not just in healthcare, but helping to take care of people in other, like this past week. We had a food pantry at the Walnut Fire Station. And we had one back in October. We had one on Halloween Day.
Really?
We had a food pantry at Walnut at the fire station, and had a lot of people turn out. And we're going to be doing more and more of those. Our people really like to do them, and our social services people that are out there in the community trying to help people, they really enjoy doing those food pantries like that.
Mm-hmm. Well, you know, that's not really expected of a clinic. That's above and beyond. That's wonderful. It really is.
And some of the other things that we're doing, we've touched on the medical clinic part, but, we also have dental. We have dental at Ashland, and we have a brand new dental clinic at Walnut.
Do you have a dentist at Ashland?
We do have a dentist. The dentist at Ashland splits time between Walnut and Ashland. Right now, he's at Ashland 3 days a week and at Walnut 2 days a week. And we really expect that to grow, because the Walnut Dental is the first standalone dental clinic that we've got. It's on the same campus with the medical clinic up there, but it's a separate building. You drive by and you see Walnut Dental Clinic on the front of the building.
Uh-huh.
So, and it's a beautiful building, and a really nice setup for dental. And we have a lot of patients from the Walnut area, a lot of patients. We also at Walnut we've completed this year the Walnut Imaging Center. We're going to be doing mammograms there. We're very close to getting that done. We've had the mammogram machine in for several months, and we've finally got us a tech hired as the coordinator for that, and hopefully we're shooting to by the end of January, 1st of February, to start doing mammograms at Walnut.
I noticed when I went to see Dwayla, this little fella came in there and he said, "While you're here," he's called me a couple of times and I got rid of him. He said, "While you're here, let's do your wellness check."
Absolutely.
He did. And that was one of the things he asked about. And he said, "I know you just go to the doctor once a year." I said, "You're right."
I'll tell you a story about that, about the wellness visits and what we do on wellness visits. We came in one day and we'd been somewhere, and I pulled back in the parking lot at the clinic at Ashland, at the office there. And I see this guy walking around the parking lot. I said, "I know him. He's from Holly Springs." And he's an elected official in Marshall County.
Uh-huh.
And so I went out there, and I got out. I pulled up beside him. I was in the company vehicle, and I spoke to him. I said, "How you doing?" He said, "He's doing good." He was on the phone, so I didn't get to spend much time with him. He said, "My wife's in there seeing Dr. Hussein, who's one of the doctors at
He's
Ashland."
very good.
And the next time I saw him, I asked him, I said, "I was really surprised to see you come to our clinic at Ashland." He said, "Oh, yeah." He said, "My wife loves Dr. Hussein." He said, "The way they do those wellness visits, it was what really was what she liked about our clinic and what we do." But we have patients come from all over. At the clinic at Ashland, you'll drive through the parking lot. There'll be cars from Tennessee, cars from Marshall County, which part of the Marshall County deal is we've got a clinic under construction at Holly Springs now. So sometime middle of next year, we're going to be opening a clinic in Holly Springs. So if you're on Highway 78 going toward Memphis and you see that brand new building backed up to the interstate out there behind Wendy's, that's our new clinic building.
Right.
So,
Do you remember Dixie that worked out there, Dixie Hamilton?
I do. I never did know her, but
she's
I knew her when I saw her. I never
She
did.
was my friend, and the first time I went out there, she told me, she said, "Daryl, these doctors are good." She said they're very good at diagnosing things. Well, it wasn't long after that, my first husband, he just had this virus that wouldn't go away, and it just wouldn't go away. And I didn't catch it from him. And his legs were Charlie horse, and he was weak as water. And he said, I remember one day he said, well, I'm fixing to go to work. I said, no, you're going to the doctor. He said, I've been to the doctor everywhere. I've seen everybody. I said, no, I heard about this little clinic at Ashland. I said, we're going there. He said, Daryl, he said, you're wasting your time. I said, we'll see. Well, I took him out to Ashland against his better wishes. And they did blood work and, did what they had to do. And he was coming down the hall, and for a little bit, he just went blind. And I called, and this doctor says they had gotten his blood work in, and he said, very bad, very bad. Said, he's got to go somewhere, very bad. They wanted to make him another appointment, but when he went blind, he had to do something right there.
Right.
He said, take him to the nearest emergency room, but I took him to Memphis. And he had a tumor, a large tumor in the pituitary area of the brain. It's right under the brain.
Right, under the base of the brain.
And then kidney failure. We've been going to all these doctors, couldn't nobody find it, and they found it. They told me, said this very bad. And he lived on dialysis for 5 years. And I've never forgotten that them little fellas out there, they're the ones that diagnosed him and sent him. They're the ones that told me where to take him, because I wouldn't know. But I'll always be grateful for the help I got out there. I don't know if other people feel that way, but I do. When somebody helps me like that, I don't forget that. But I just don't know what we had done. As we just kept going from one place to another and couldn't get any help. So I've never forgotten that. But they are very good doctors out there. Well, after I moved to Ripley, I moved to Faulkner, and then we were moving, I was coming to Ripley. We started going to this clinic. I got to be friends with Dwayla down here at the TV station, and I remember this doctor was treating Tate for a back problem, the pulled muscle, and and Dwayla called me and she said, Daryl, how's Tate? And I said, 70 years old and ornery. She said, no, I'm a doctor, Daryl, I want to know. So I told her. She said, we are missing something. She said she had watched him walk down here. She said, we are missing something. And she told me, she said, you take him and insist that your doctor do a bone scan. So I did. And I told Tate, I said, and they found the fractures in his spine. I told Tate, I said, honey, we're seeing the wrong doctor. Like, she can just see him walking around down here and know, that's who we need to see. But now, she's real good for me. She is wonderful. I just love her. She is great. She's terrible for y'all, because if everybody wants to see her, I can't get in. No, I'm telling you, don't fill my doctor up. She is really a fantastic doctor. I understand you have some new doctors. Don't you have somebody that I don't know down there?
Here at Ripley. We have a nurse practitioner in the clinic with Dr. South, Whitney Walker. and she is
I don't know her.
she is a hard worker, and we are very proud of everything that she does there. Ripley is one of, if not our busiest clinic, and they see a lot of patients there, and everybody is loyal to their own doctor. We have
Yes.
folks like yourself come in to see Dr. South, and
Oh, yeah, I wait on her.
we have other folks that come in there to see Whitney, and she does a great job too. And we've recently, speaking of that, we've recently added a second nurse practitioner at Walnut, part-time. Stacy Lowry is her name. Hannah Wilson is the nurse practitioner up there. That was the one that was already there, and then we added two new exam rooms at Walnut as part of that construction we did up there, and added a second nurse practitioner 3 days a week.
I'll have to go up there and have a look at that.
You do need to go
I
by and
bet
see
that's
that.
nice.
That is a very nice. That whole campus looks great up there. Especially you drive by at night. We did some very nice lighting on that campus. It really looks good.
I am very impressed with this. Of course, I go to Ripley, I go to Wiley, you know I do. But I'm very impressed with how clean and sterile everything is. If she drops a piece of cotton, it goes in the garbage. And I've spent a lot of time taking care of sick husbands, and I know that's not always the case everywhere. But if they drop something, it goes in trash. And maybe because I'm a hairdresser, maybe that's why I notice it. But I noticed that. If it's been in that floor, you don't know who's walked on that floor.
Right.
I don't want that on me.
We've also got our new telehealth center at Ashland. You're talking about new things that we have. New clinic at Holly Springs under construction. The telehealth building at Ashland is almost finished.
Tell me what that is.
Well, what it's going to be is it's going to be a place where if you need to see a specialist, your specialist may be in Jackson, Mississippi, or Memphis, or even somewhere else. But you'll be able to come in, and that building will be equipped. Those exam rooms will be equipped with the equipment, so the doctor can do an examination remotely, virtual examination.
Really?
And so, we've talked about, and we've got a meeting that's coming up in next week. As a matter of fact, they're going to come, the University Medical Center from Jackson, which is a partner with us on that project. They're going to come up and take a look at the building and kind of talk about what equipment needs to go in it. We've got the furniture ordered, but we do need to order the telehealth equipment. And so it's a 2-story building. The first floor is going to be the telehealth, and the second floor is going to be the administrative offices.
How does that work, that telething?
Well, what they'll do is that there'll be like a TV monitor or a screen on the wall there with a camera, and you'll be able to talk to your doctor remotely. There'll be a nurse there that's trained on the use of the equipment, and let's say you're seeing the cardiologist, and they have a stethoscope that they'll be able to use that will transmit that sound over the internet, and the doctor, wherever he is, will be able to listen to your heart. It kind of grew out of the pandemic.
Really?
When they were doing a lot of telehealth
Right.
stuff in the pandemic, and so that building was a grant that was applied for in 2008 to 2020, maybe something like that. And it's been under construction for a little over a year now, and we're very proud of that building and very proud of what we're going to be doing there.
Wonderful.
So.
Yes.
And it's going to be the only elevator in Ashland, Mississippi, in the town of Ashland.
Really? I tell you, Dwight sent me to a heart specialist some time back, and they came to the hospital there at New Albany once a month, so I saw them there. But you got to park way down the hill, and then get from down the hill to the front door. If you've got a mobility problem, that's a problem. And then you got to go around, all the way around to the elevator and go up to the 5th floor and then all the way across the building. So man, I would love this. Yeah.
Mm.
Yes. And the elevator is wonderful. Yes. That is wonderful. 'Cause, if people, as you get older, you think when you're young that you're going to always be. I thought I was always going to be able to walk around and do what I wanted to do. But as you get older, it's not always that way.
Right.
As they say, the old gray mare ain't what she used to be. Guaranteed thing. You have a board to answer to, don't you?
We do. We have an 11-member board of directors. They are from Benton and Tippah counties. And that's part of part of what everybody has certain roles. As a federally qualified health center, everybody has a certain role, and I answer to the board of directors and provide them with the information, and they make policy decisions. So, and we have a great board of directors, very interested in the clinic and the mission and what we do, and they understand and they know what NMPHC and these clinics mean to the communities they're in.
Yes. I tell you what, there's folks that would not get a doctor. Now this sounds far-fetched to somebody that's still working, but we see some of our elderly folks deciding whether to buy groceries or medication, and that's a shame. And I still work half a day a week in my beauty shop, and I do older ladies, and I couldn't tell you how many of them ladies have talked about breaking their pills in half to make them last longer because they didn't have access to them. If you don't qualify for a good drug plan or maybe don't know to get one, that's a lot of it if you don't know to get one. Now, I know when I went up there to Ripley, they talked to me about that. She wanted to know, did I have a drug plan? Did I have, if I have the things that I need for, folks that go other places, they probably are not, they don't know. Some of these older folks, they don't know what's out there that's available. And, of course, now they've got these new Medicare things, this Advantage thing that they talk about. Now they say some of the hospitals won't take it.
That's
a bad thing.
It is, and that's one of the things I saw. There was a feature on, it was one of the national news networks the other day that featured the hospital in Holly Springs and Dr. Kenneth Williams.
Really?
And that was one of the things that they were talking about is that they recently converted that hospital into a rural emergency hospital. They don't do inpatient anymore there. And so one of the things he was talking about was what pushed them to that point was the fact of the Medicare Advantage plans not paying for the inpatient care or not paying well at their hospital in Holly Springs. So, I mean, it's right here at our doorstep. And you can see the struggles out there, particularly in rural hospitals.
Yes. And this, it's all over YouTube about these, online hospitals have quit taking it, and the doctors are not taking it. So if and they bribe you to get on it with a grocery card.
Oh yeah, I mean,
incentives.
He trying to sign me up on it, and it's
I do too.
it just back during that open enrollment period, I hated to see my phone ring because I knew, probably 3 times out of 4 it was going to be somebody wanting to try to sell me a Medicare Advantage plan.
Oh, I saw something on YouTube right at the start of that open enrollment, and that's the reason I didn't do it. But a lot of my friends did, and I worry about how they're going to get medical care. There's a lot of scams out there, but you don't expect the government. You don't expect them, not to have your best interest at heart, but sometimes they don't. And maybe they started that meaning well, and it just didn't work out.
Well, it's a program, and what I don't like about it, I think it was designed to help insurance companies. You know, I think it was a program. Medicare Advantage was really done to help insurance companies be able to get some of the Medicare money, and I just, I don't like that. Uh, every time when I have talked about it with my mother, and now my wife had to go through it a year or so ago, and I asked some people that would know, people that I thought were experts, and I said, what do they need to do on their Medicare? And they said, no Medicare Advantage, plain regular red, white, and blue Medicare. They need to stick with the regular red, white, and blue Medicare.
I think so too. But a lot of them, they make it sound so good.
Oh yeah.
Yeah. But that's the way scams are. They make it sound so good.
That's right.
And I don't know if that's what you would call a scam, but I don't think it's a good thing. Anyway, I didn't do it. Nope, didn't do it. And all it takes is one phone call to ask about it, and they'll have you signed up.
Oh yeah, that's right. That's right.
So it don't do to ask. But y'all beware of that Advantage thing. Absolutely. We've talked about what's new in the clinic now. Let's talk about what we're going to do. Now, you said you were going to start one at Holly Springs.
That's right.
And then you're going to have this tele thing that I think is amazing.
Mm-hmm.
Yes, I do. No having to walk. Oh, yeah. I'm for that. Dwight will send me over there first time I go over there. She will. She will. But what kind of plans do you... I know that if you don't have... Now, that between 62 and 65, that's a hard time.
It is. It is.
You've got no insurance.
Mm-hmm.
I mean, and if you hold on to that from work, it's so expensive you can't pay for it.
Right.
People don't realize that when they retire early.
Absolutely, and that's, the same thing. Of course, I spent a lot of years in the state retirement system, and with state retirement, of course, if you get your 25 years in, if you came in when I did, the folks that came in a little later have to get 30 years in. But also, you can retire at any age with any number of years. I mean, at 60 with any number of years, not any age. At 60 years old with any number of years.
Yeah.
But one of the things that keeps people from being able to retire at 60 in the state retirement is the fact that they've got to have insurance. And so that insurance at that age is generally pretty expensive. And
It
so,
is.
that you do have that gap in there between either 60 and 65 or 62 and 65, 62 being Social Security age.
It's terrible. I remember when Tate was horribly sick, and my second husband, Tate Jeter, and I was taking care of him, and I didn't have the money for medicine. I didn't have money for nothing. I mean, he had to have these inhaler things, and I know at the clinic they gave us samples. I don't know what we'd done if they hadn't. They have helped me so much. I got no complaints, I'm telling you. But they have something called...
Based on income. And it starts out that if you're on sliding fee A, anything you have done at the clinic is $20. You come in, no matter what you have done, it's $20. Sliding fee B, C, and D, they're percentages based on your income. You pay a certain percentage of what the bill would have been. So
For $20, you can't see anybody for $20.
Right. I mean, that's...
let's face it, that's amazing. And that, I believe they save lives out there, I really do.
Oh, absolutely we do. I mean, it's you have people that if it weren't for us, I have a guy that works with us that always talks about his grandmother being able to afford her medication because she goes through our program. And, that's another great benefit to our patients is the 340B prescription drug program that allows us to give discounts to patients on their prescription medication. Very expensive prescription medication.
Yes.
and it is a great program. And I had a gentleman that, again, a state retiree, told me that he had switched in his second year of retirement. He switched. He's from down in southern Marshall County, and he had switched and started going to our clinic at New Albany. And he told me the first year there that he figured that had saved him $10,000 in medication costs the first year.
Absolutely.
So.
And they see to it you get your medicine. No, they really do. Now they'll see to it that you can. My granddaughter, she says, "Grandma, when you go into the doctor?" I said, "When I have to." "When are you going to the doctor?" I guess when they call and tell me I have to. I don't know why, but as we get older, we put that off. And sometimes that's not wise.
Right.
We're used to, like when my children were small, we lived in Oklahoma, and they were babies. And, the doctor bills were so expensive. And you couldn't pay the rent because you had these big doctor bills. And that's just because I had a child that was sick all the time. And it just, we didn't have access to help, but now there's help out there. And there's not really any great excuse for not going, but don't tell my granddaughter that. But I do. I appreciate what you do for people in this county. This is, my question is, what's special about this clinic? I think that's it. That clinic helps people.
Absolutely, yeah, I believe that, and that's the mission. That's what it was there for. It started out. I tell people all the time that it started out as a community project to bring health care to rural Benton County, Ashland and Benton County, that didn't have anything at the time, and has grown over the years to be able to serve basically the northeast corner of the state, from Oxford to Tishomingo, and
You're about to get that covered, aren't you?
we're just about to get it covered, and that's we're very proud of that, and that was one of the things you talk about. What we're going to do, what new things we have planned. Well, next year. Probably around April or so, we're hoping to break ground on a new building at Corinth.
Really?
We don't own our building in Corinth, and we have bought a lot across the street, and we're planning on building our own building there. It's going to look very similar to the one at Holly Springs. We're building those clinics on a almost identical floor plan, and so that will be sometime next year, and then after that, our order is we rent buildings in Oxford and New Albany too, and the plan is to eventually build a building. Oxford will be next after Corinth, and then at some point the New Albany clinic will build our own building there.
I have to say, I have to plug our hospital here. I've not been inside the new building. But when my last husband was so sick and he'd had a stroke, and we went there for therapy, they really were good to him. And they set up, we stayed so many days that Medicare would pay for, and he just needed to be there. And they set us up a payment plan that we could afford. It wasn't a ridiculous amount, that we paid each month till we got it paid out. And, I can't see that happens everywhere. I have to say, there is help here. If you need help, there is help here.
Well, Tippah County is very fortunate. We
are.
I know that it's a struggle, and the hospital here is struggling, just like all rural hospitals are struggling. But to have a new hospital facility in Ripley is a testament to what the people at the hospital and what the county is and the city and all is committed to.
They tell me it's beautiful.
It is. It's beautiful.
In fact, a lot of people go down there just to eat. They do. I promise you they do. They'll go down there just. But it's amazing how they help people. And then between the clinic And the hospital, there's no excuse not to get the medical help that you need. It's just not. And if you live closer to Ashland, there's one over there. One, you said there was one at New Albany. I didn't know that.
Yep.
I didn't know that. On Bankhead, that's right there on the main
On
road.
the main drag, on the main.
How did I miss that?
It's right by the west of the Reed's grocery store there.
Well, I know where Reed's is. I guess I was busy looking at Reed's. That's bad. That is bad. But the clinics are clean. They're disinfected. It's not a fly-by-night thing. It's really it's well organized. And no, I want to talk about some of the improvements that I have noticed going down there. Shorter wait times.
Well,
We're seen on time now.
Well, we had a struggle. It's kind of funny. My first day on the job as CEO, we implemented a new record system, a new practice management system, the system that runs the whole clinic on the computer system. And it's been a struggle. I'll be honest with you. It's been a struggle. Our folks have put their shoulder to the wheel and worked through it. And a lot of the things that were very evident to patients, like not being able to get an appointment, the wait times, things like that, those have improved.
The last time I went, I like to be 5 minutes late. They're sitting there waiting on me. I was embarrassed.
Well, but it's a struggle no matter where you are. We've talked to several different clinics that have gone through the same thing we have. And matter of fact, at our last all-staff meeting a couple of weeks ago, or last week, actually, we had a group from a sister health center down in southwest Mississippi, down at Liberty, and they got on and did a Q&A with our staff, and some of the things that we talked about, that we asked questions about, they said we experienced the same thing. Mm-hmm. So, one of the things that I said when we came out of that, and I told our staff, I said, well, the good thing about that is that you see now that the struggles we have, we're not the only ones that have these struggles. And it's just, I had a CEO from another health center told me on the front end that she said there's no easy go live, and there's no good system. So, and that was her answer to me, and I said, we see that, and I know that you as a patient saw the delays and some of the disruptions and some of the frustration with our staff during that time. But we're making progress, and we've put together a real team effort to tackle that. And I think we're making progress, and it's all because of the team that we have.
Well, years ago, the people used to say, well, they can go to Memphis and be back, see a doctor and be back before they see one at Ripley. That's not true anymore. It's really not.
Right.
The last couple of times I went, like I say, you run late, they're sitting there waiting on you. No, it's not like that anymore. You don't expect
kind of like you were when I walked in today. I was running just a little late, and you were sitting here waiting on me.
Yeah. But that I was impressed with that, not having to. I would sit there and waited. I'd waited on Dwayla. But she was right on time. That just it's not typical in Tippah County. Not just that everywhere. The old clinic downtown. I remember one time I went down there and sat all day, and I finally got up and I went to the desk and I said, it's getting late. I said, how long is it going to be? And she said, oh, he's gone home.
I remember that old clinic in downtown Ripley coming over here, and I remember walking in there, and they had 2 or 3 waiting rooms, and they were all full.
Yes.
Every one of them was full.
Yes. Well, when you called, they say you can be there 4th, 9 o'clock. Well, if you got 4 people coming at 9 o'clock, somebody's going to be sitting there. But then on the other hand, if I get there and I've got an appointment, say at 9 o'clock, and something happened at 1 o'clock, say somebody needed stitches, or I'd rather them go ahead and do that and not, not slack on that patient to get to me. So sometimes you can understand people,
Right.
they have to take care of that patient that's in there. I mean, if they're not exactly on time, they just can't help that. But now this, 2 and 3 hour waits don't work. Which we years ago, now it's been years ago, we saw that. So that's greatly improved. And I've noticed that now everything's online.
Oh, yes. I mean, that's one thing that that we're constantly trying to improve and constantly trying to utilize more of is the
You
technology.
do realize that some of us old folks don't know much about online.
Well, there's some people that struggle with that, but it's all trying to make things better for everybody. So we,
Go in
we,
there
we'll,
and I say, honey, you see this thing? No, I ain't good at that. But truly, it's much more efficient. If you've got a lot of that already done, and everybody doesn't have to sit there and wait on you to
Right.
do it. They gave me a clipboard with some stuff that you had to click off and sign your name, but that was all. Everything else was done online. And they send me a thing or something, tell me about this chart thing, this my chart thing. Yeah, I've got something that's my chart that tells me if Dwayne's fussing and wants me to come to the doctor.
It's a patient portal, and I have not actually used that much. I get the notifications, like I got a notification the other day that I had a little bill out there, and I went in and looked at my bill and all that. And one day I got a notification that I had lab work there, and I did that. So, yeah, that is another aspect, and part of that. Our new system, the old system had some of that, but the new system has that patient portal app that you can use on your phone.
Well, let me tell you the trick to it. I figured it out. You take a tablet and you write your password down. You forget that password, you're in trouble.
That's right.
Write it down, glue it to the refrigerator or somewhere that you'll remember. Because
We have too many passwords these days.
Yes, we do. Yes, we do.
My son works in IT, and he tells me all the time. He reminds me they are a necessary evil.
Yes.
Passwords are a necessary evil.
Yeah, they're evil, all right. and it doesn't make sense. A lot of this stuff online, it just all you got to do is click that forgot your password and change it. So I don't know that it's so safe anyway. But maybe it is. I don't know. I'm not very electronic. I don't know a lot about that. What impact did the COVID have on the clinics?
Well, I really came on board toward the end, or kind of after the pandemic subsided, but it was a tremendous impact, and it changed the way that everybody did business. Of course, we're seeing ups and downs. My mother had COVID this past week, and so we see people with COVID. I've got a grandson with COVID right now.
Oh, no.
And so we see COVID. It resurges from time to time. But last week we had a lot of people out with the flu. The flu was real bad. We had one day we had 13 people out with the flu out of the clinics. So it's been a challenge, and when you go through these seasonal things, it's always going to be a challenge.
COVID is very in the spotlight right now. And in fact, my last husband died with COVID. That's just nightmare. But I remember when Tate Jeter, my second husband, had the flu, and he never recovered. So, the flu is just as dangerous if you've got a lung problem or something wrong with you, well, they say that's the way COVID is.
Mm-hmm.
So I don't know if it's more dangerous than the flu and strep and stuff we've dealt with all these years.
Yeah.
I don't know. But they scared us to death. I mean, you saw on TV where they were putting bodies in this refrigerator in New York, in this refrigerator truck,
Mm-hmm.
just stacking them up. And, we heard so much and, wear this mask and do this and don't do that. And, we were made so aware of it. Now we say the word, we're scared to death.
Mm.
But I'm not sure that it's any more dangerous than the flu if you've got a lung problem. I mean, now my stepson has had COVID 3 times. He's an EMT,
Mm-hmm.
so he's around it. And it caused him to have blood clots.
I've heard of that. I've had folks in my family. My son-in-law was on a respirator for nearly a month with
That's
COVID.
horrible.
So.
That's horrible. I mean, I'm not saying it's not dangerous, but I'm saying the flu is dangerous too.
Absolutely, they are. Yeah.
There's a lot of stuff out there that's dangerous, and now they say there's something, RSV.
RSV. I hear a lot about RSV.
I don't know what that is.
I haven't seen any big numbers. I can't remember what it stands for.
I wouldn't know.
It's a long drawn out phrase, and that's why
But
they call it RSV.
They
So,
say it's terribly
yeah.
dangerous, especially as you get older.
Mhm.
I think I'm in that group. Not good, not good. Tell me, do you still call ball games? I want to get this in before we're out of here.
I do. I didn't do very many this year. I do that at the radio station at Holly Springs. We haven't done any basketball games so far this year. They had contacted me back in November, and contacted me about a game or two, and then they didn't do those, and then haven't done any since then. I did do 2 or 3 football games this year, this past year. So I still do that a little bit.
I just wondered if you were still doing that. I figured you were, but I just wondered. Now, this is North Mississippi Primary Health Care, and they're everywhere. I've given up on it. They're just everywhere.
From Oxford to Tishomingo.
Yes. Okay, if you're here, if you live close to me, the number is 662-837-0000.
That's an easy one to remember.
Yes. Isn't that amazing?
That's an easy one to remember.
Yes, it is. But and truthfully, if you don't know the number closer to you and you live, say, close to Ashland, or if you can't find it, we don't have phone books anymore.
No, we don't have phone books
So
anymore.
call this number, this 837-0000. That's easy to remember. And just ask them, they'll tell you.
Well, they can transfer you.
They'll kill me, won't they?
They can transfer you. The home office number, the office at Ashland, is 662-224-8951, and they can transfer you from there to another clinic too. Those are the only 2 I know off the top of my head.
Well, the only one I know is this one because it's so easy to remember. I don't know why I never get those easy phone numbers. I don't know. I always get something that you can't keep up with. I didn't know you called basketball games. I thought you did football.
I did football and basketball. Matter of fact, I did the basketball before I did football.
See how much
I started in basketball
Good.
first,
Yeah, I didn't know that.
and that was 1997 or 1998, I think, is when I started doing that.
Something. But this is Bill Stone, former state senator, now CEO at North Mississippi Primary Health Care. I do appreciate you coming.
Well, I appreciate the
really do.
invitation, and I know you had reached out to me several months ago and asked me, and then I stumbled back on that message, and I messaged you back, and I said I'm still interested, so I appreciate it.
I sure am glad you
Appreciate
came.
the opportunity.
So glad you joined us tonight, but Tony says we're out of time.
Okay.
He always tells me that. What's the problem is. Be sure to catch the Jeter Family Program on Saturday nights from 7 to 9. We'll be back with you Monday at 7 o'clock for Daryl's Little Corner. May God bless.